Hello, Dr. LaRock and Dr. Hoffman. I'm Haven Poe, and this is my empty head-to-toe rubric. Hello.
Hi.
My name is Haven. I will be your student nurse today, and I'm here to do a head-to-toe assessment on you. Is that okay?
Yes.
All right. Let's start by you giving me your name and date of birth.
Madison Marsh, January 2nd, 2006.
Awesome. And where are we right now?
Saginaw.
All right. And what is the year?
2026.
Awesome. You are ANO times 3, so I feel comfortable continuing with my assessment. I'm going to start off with a brief health history. Do you have any allergies?
No.
Right. Do you have any past or current medical diagnoses?
No.
Any family history?
No.
What about surgical history?
I had an ovarian cyst when I was 14, and that was removed, and you can see the scars.
All right, 14.
Mm-hmm.
So 6 years ago?
Yes.
All right, and that healed well? No issues? No infection? Good. All right, do you take any medications?
No.
Any over-the-counters, herbals?
No.
Okay. Do you participate in any alcohol consumption, drug use, whether it's smoking, vapes, marijuana?
No.
Okay. What does your nutrition look like?
I try to get all the food groups in, like fruits in the morning, vegetables at night. Try to get protein in there as well. And I think I have a pretty good diet. I try to drink enough water too.
Good. Okay. What does your caffeine intake look like?
I don't drink caffeine.
Nice. All right. What does your exercise look like?
I try to exercise around 3 times a week. I just go for a run on the trails around my house.
Nice. Very good. Do you enjoy that?
I do.
Good. All right. Do you have any questions for me before I continue?
I do.
Awesome. So I'm going to start off by getting a set of vitals on you. Can you give me, I'm going to ask, what is your pain on a score from 0 to 10, 0 being no pain, 10 being the worst pain?
0.
0. No pain. Love to hear it. All right. Do you have a preference of which arm I use?
No.
All right. Can you go ahead and roll me up the sleeve?
Of course.
Thank you. Okay. Using my diaphragm. Diaphragm is on. I'm going to take her blood pressure. All right, very nice. I got 120/70 within normal ranges. Okay. Now I'm going to go ahead and take your temperature. This one right under your tongue. Awesome, 98.6, just where we like it.
Perfect.
All right, now I'm gonna go ahead and take your pulses. I'm gonna go ahead and take your radial pulses for 60 seconds each. So take a little bit, let me find it. Very good. I'm going to move on to the other side. Starting right. Very good. Your heart rate is 74 and your respiration rate is 12. Both are within normal ranges. Now, I would normally take your pulse ox, but I do not have a pulse ox machine on me today, so I'm going to take a look at your hands. I'm going to look at your nails for any clubbing. I don't see any, which is good. Enough oxygen is getting to the end of your fingers. I'm going to go ahead and check for capillary refill. All are under 3 seconds, which is great. And I see no signs of cyanosis, so I'm comfortable assessing that your SpO2 is most likely within the normal ranges of 95% to 100%. Awesome. Do you have any more questions for me?
No.
All right. So we're going to continue with our assessment here. I'm going to inspect your arms, shoulders, and hands. So I'm going to go ahead and roll this up. Okay, I see you got some moles here. You keeping an eye on those?
Yes.
Have they changed at all over the years?
No.
All right, very good. Make sure you keep an eye out on these. Look for any changes. Okay. Very good. All right, now I'm going to go ahead and palpate your arms. I'm going to feel your muscle tone. Very nice. Temperature. You're warm. Temperature is equal on both arms. That's great. All right, can you go ahead and squeeze my hands? All right, and then push your hands like this. Push up. Push down. Like this. Push out. And push in. Good. All right. Now, do you know how to swim?
Yes.
All right. I'm going to have you do the swimming motion with your arms. I'm going to put my hands on your shoulders. Any pain or tenderness with that?
No.
Good. All right. I feel no cracking, so that's a great time. I'm going to go ahead. I already took your radial pulses, but I'm just going to go ahead and compare them for symmetry here. Very good. Symmetrical and strong. Radial. Very good. Radial pulses are symmetrical and strong. All right. Now we're going to go on ahead and move to your head. All right. Do you have any issues with dry skin?
No.
All right. Do you dye your hair?
No.
All right. Looking at you, your face looks symmetrical, so no issues there. Is it okay if I just put my hands through your hair?
Should I take my hair out?
Sure. Okay. That'd be helpful. Thank you. All right. Do you have any pain or tenderness or itching with this?
No.
Good. I feel no bumps, no abrasions, nothing like that. I'm going to go ahead and palpate your occipital lymph nodes back here. All right, very good. No swelling. Do you have any issues with your lymph nodes being swollen?
No.
Very good. Okay, now I'm going to go ahead and move on to your eyes. So I see you wear glasses.
Yes.
Do you wear contacts?
No.
How often do you get your eyes checked?
Every 6 months.
Every 6 months. Very good. All right. So far, your eyes appear equal and round. So I'm going to do a little test just to confirm that with my pen light. So, awesome. All right, just look straight. Very good. Can you look at my pen light for me? Sure. Look at my hand. Pen light, hand, pen light, hand. All right, now I'm going to move on to the 6 cardinal fields of gaze. So I'm going to have you keep your head straight and follow the tip of my pen light with your eyes only.
Okay.
Very good. Cranial nerves 3, 4, and 6 are all intact. All right. So now your eyes are parla. Your pupils are equal, round, reactive to light, and they accommodate. So I have no concerns about your eyes. All right, now I'm going to move on to your nose. Have you ever broken your nose?
No.
All right, do you have any troubles breathing?
No.
All right, any allergies that affect your nose?
No.
Awesome. Is it okay if I give you a little pig nose and look up your nose?
That's fine. Okay.
Right, color and hair distribution looks good. I'm going to have you close your eyes for a second, and then I'm going to have you smell something, and I want you to tell me what it smells like. Go ahead and smell.
Cinnamon.
Cinnamon, perfect. All right, now I'm going to go ahead and palpate your frontal and maxillary sinuses. Any pain with this?
No.
All right. Do you have any issues with congestion?
No.
Okay, now I'm going to move on to your mouth. Looking at your lips, they look symmetrical. No issues there. Do you have your tonsils?
Yes.
Okay. Do you have any dental implants or anything?
I have a metal bar in my lower teeth. It's like a permanent retainer.
Okay. Awesome. No problem there. Do you have any issues eating?
No.
Okay. I'm gonna go ahead and look in your mouth. I'm just making sure that everything's normal and symmetrical. Yep, I see that bar. Okay, everything looks good. Can you stick out your tongue for me? Stick it to one side, other side, stick it out and go, Good. Uvula rises with phonation. Cranial nerves 9, 10, and 12 are all intact. All right. Now I'm going to do a quick sensation assessment on your face. So I'm going to touch different areas of your face with this Q-tip, and I would like you to close your eyes and tell me where you feel it.
Forehead, left cheek, nose, right cheek, chin.
Very good. All right. So now I'm going to have you clench your jaw, unclench. Good. And then make some silly faces at me. Very good. All right. So your cranial nerves 5 and 7 are also intact. All right. Now I'm going to move on to your ears. I'm going to pull up and back the pinna. Come behind the ears. Do you have any issues with your hearing?
No.
Very good. You've had no problem hearing me throughout this assessment so far, so I'm comfortable assessing that your 8th cranial nerve is also intact. Okay. I'm going to go ahead and palpate your pinna here. Okay, and then I'm going to palpate your preauricular lymph nodes, postauricular. Good, no swelling there. Awesome. Now I'm going to move on to your neck. So looking at your neck here, your trachea looks symmetrical. All right. Skin tone looks even. You're not breathing with any accessory muscles, which is great. Can you go ahead and shrug your shoulders for me? Good. All right, your 11th cranial nerve is also intact. All right, so I'm going to go ahead. Do you have any issues swallowing?
No.
I'm going to auscultate, which means listen to your carotid arteries here. I'm going to be using my bell. So I'm going to go ahead and do that. I'm going to find them. My bell is on. Very good. On the other side. Very good. No worries. Nothing abnormal there. Now I'm going to just palpate your pulses, make sure that they're symmetrical, but I'm going to do them one at a time. Okay. Symmetrical and strong. Okay. All right. Now I'm going to go ahead and palpate the rest of your lymph nodes. Okay. You have your submandibular, your submental, your cervical chain. Would you go ahead and go like this for me? Good, relax. All right, that's your supraclavicular lymph node. And then I'm gonna assess your tissue trigger here. So I'm just gonna pull your skin up a little bit. No tenting, which is good. All right, now I'm gonna go ahead and go behind you. Okay. All right. And if you could scooch back a little bit for me, that would be great. Thank you. All right, so I'm gonna go ahead and find your cricoid cartilage. Okay. So I'm gonna be deviating your thyroid.
Okay.
And I want you to swallow when I tell you to.
Okay.
We're gonna make sure there's no pain, no swelling. I'm gonna deviate it to the right. Swallow. Okay. No pain with that?
No.
To the left, swallow. Good. No pain with that either?
No.
Very good. All right. I'm gonna go ahead and inspect your neck and your back here.
Big hair differences.
Thank you. All right. Same situation with the moles here. Keeping an eye on them.
Yes.
Very good. Great. See it. Next look good. All right. I'm gonna go ahead and inspect your lung expansion.
Okay.
So I'm gonna go ahead and have you take a deep breath. Good. So I was able to find T10 by doing that. So your lungs are symmetrical and you have even breath expansion. So I'm gonna go ahead and auscultate your 12 lung sounds.
Okay.
To do this, I'm going to use the diaphragm, and then I'm going to listen to 12 spots on your back.
Okay.
I will ask you halfway through if you need a break. And find your spine. Can you engage your... Perfect. Relax. Okay. Go ahead and take a deep breath. Good. Another one. Good. Again. 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 All right, do you need a break?
No, I'm good.
Again. 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 All right, and then one last time. Very good. Breath sounds are clear, no crackles, no wheezing, no bronchi. Now I'm gonna go ahead and percuss your 12 lung spots, hoping to hear tympany in all locations. Sorry, not tympany, resonance. Resonance in all 12 lung locations. We'll start over. No pain with this, right?
No. No.
Okay. All right, awesome. I hear resonance in all 12 spots, so I have no concerns there. Okay. All right. I'll have you lay down.
Okay.
All right, I'm gonna actually take this pillow
Oh,
out
of
from under
course.
your neck. All right, can you turn your head to the left for me? And then to the right. All right, relax. All right, I see no jugular vein distension,
Okay.
which is good. So now I'm gonna go ahead and inspect your chest. Is it okay if I pull this down a bit?
Of course.
Sorry.
Laying on it.
Perfect, that's good. All right. So looking at your chest here, I don't see anything abnormal. A little acne, it's fine. All right. Have you ever broken a rib?
No.
And are you having any chest pain?
No.
Awesome. Okay. I'm gonna go ahead and auscultate your heart sounds.
Okay.
So for this, I'm gonna be excuse me. I'm gonna be listening to a few different spots.
Okay.
For each spot, I'm gonna be using my bell and my diaphragm.
Okay.
So I'm listening for the lub dub sound, and then I'm listening for any murmurs.
Okay.
Okay. so my diaphragm is on. All right, on the right side, we have the clavicle, space, rib 1, space, rib 2, second intercostal space. With my diaphragm, I'm going to listen to the aortic valve. Very good. Now I will switch it to my bell. Very good. No murmurs. Now I'm going to move on to your left side, switching it back to my diaphragm. Your left side, I'm going to go clavicle, your space, first rib, first intercostal space, second rib, second intercostal space using my diaphragm. I'm going to listen to the pulmonary valve. S1 and S2 are nice and strong. Switching to my bell, listening for any murmurs. Very good. All right, switching it back to my diaphragm. I'm going to continue to our third rib and the third intercostal space. This is Herb's point that I'm listening to. Very good, nice and strong. Switching it to my bell. Very good. Okay. Back to my diaphragm. Maybe. There we go. Okay, I'm gonna go from underneath. All right, we're feeling for the fourth rib, the fourth intercostal space. I'm right here. I'm going to listen with my diaphragm. Good, nice and strong. Sorry about that.
It's all good.
Switching it to my bell. Go ahead, listen for murmurs. Very good. And that is your tricuspid valve. And then we're going to move to the fifth rib and the fifth intercostal space. I'm gonna go mid-clavicle, mid-clavicular. All right, I'm gonna use my bell first, and I'm going to listen for any bruits. All right, I hear none. Switched it to my diaphragm. All right, now this is your mitral valve, and this is where your apical pulse is. So I'm gonna listen to your apical pulse for 60 seconds.
Okay.
All right, S1 and S2 are strong. All right, very good. I got a heart rate of 76.
Okay.
So very good, within normal ranges. You can go ahead and put this back on.
Okay.
There you go. And then I'm gonna go ahead and roll this up. Is that okay?
Yeah, that's fine.
Okay. And expose your abdomen here.
Sure.
Would you mind rolling down your pants one
Of
for me?
course.
Awesome. All right. So now moving on to your abdomen. So I'm
Okay.
gonna go ahead and inspect your abdomen. I'm gonna go from the side. Okay, I'm gonna go from the end of the bed. Very good. I see no bulges or masses, no lesions. I can see your abdominal aorta pulsating, which is very good, nice and strong. All right, so I inspected. So now I'm gonna go ahead and auscultate your 4 quadrants.
Okay.
And I'm wanting to hear 5 gurgles in each quadrant.
Okay.
So, using my diaphragm, can come right over it. All right, so I'm gonna start in the right lower quadrant. Very good. Right upper quadrant. Very good. Left upper quadrant. And the left lower quadrant. All right. Very good. Yes. And you said your scars from your ovarian cyst surgery.
Yes.
No issues with those?
No.
Awesome. All right. So now I'm going to go ahead and auscultate your abdominal arteries here.
Okay.
So I'm going to start by finding the xiphoid process in the umbilicus. You can see it all. Okay. I'm going to meet halfway. So here is our abdominal aortic artery. So I'm going to go ahead and listen to your arteries here with my bell, listening for any bruise. All right, I'm going to turn my bell on. Okay, very good. I'm gonna go out. This is your left renal artery. Very good. Your right renal artery. I'm gonna go down to your left iliac artery. Very good. And now your right iliac artery. Very good. All right, I found no bruise, so I have no concerns there. All right, so I auscultated your abdomen. Excuse me. So I'm gonna go ahead and percuss your abdomen. So I'm going to tap on it, and I'm wanting to hear tympani in all 4 of your quadrants.
Okay.
So right lower, upper, left upper, left lower. All right, good. Tympani and all. And I'm gonna go ahead and do the same thing from your right lower quadrant up until I find the border of your liver. And I will know when I get there when it turns into a dull sound instead of tympani. One more time. All right, so here's where the border of your liver would be. So now that I percussed your abdomen, I'm gonna go ahead and palpate. So I'm gonna start off with light palpation, and I'm trying to see if you have any pain or tenderness here. Any pain or tenderness?
No.
Okay. I'm gonna go ahead with a deeper palpation.
Okay.
Same thing. No pain or tenderness?
No.
All right, good. I don't feel anything abnormal. So just what we like.
Okay.
Excuse me. Okay, so I have inspected, auscultated, percussed, and palpated your abdomen. So now I feel comfortable proceeding. So I'm gonna go ahead, put this down a little bit for you. So now we're gonna move on to your femoral artery and your femoral pulse.
Okay.
Femoral, however you would like to pronounce
Of course.
it. So I'm going to be using my bell, which I already have on. So I'm gonna go ahead and find your femoral pulse with my hand first.
Of course.
Can you go ahead and put your legs in like frog legs
Yeah,
for
sure.
me? Thank you. Okay. With my bell on. All right, and I'm right here. Very good. I feel no bruise. All right, now moving to the other side. I'm gonna find it first. All right, I'm right here with my bell. I'm gonna go ahead and listen right here. All right, all good. I hear no bruise there either.
Okay.
All right, you can straighten your legs back out. All right, we can cover you up a little bit. All right, now I'm gonna go ahead and move on to your legs.
Okay.
Can I take off your socks for you?
That's fine. They're not very pretty feet, so.
That's okay. I'm not judging.
Okay.
All right, so now I'm gonna go ahead and inspect your legs here.
Okay.
Same situation with the moles, keeping an eye out.
Yes.
Good. Okay, looks like you had a little blister here on the bottom of your left foot.
Yeah.
What was that from?
Just probably wearing shoes too tight.
Okay, it's been healing well.
Yes.
Yeah, it looks good. No drainage or anything, no swelling.
No.
No discoloration. We love it. Okay, so everything looks good. I'm gonna go ahead and palpate your legs here. Good muscle tone. I'm not feeling or seeing any edema, which is
Okay.
great. So now I'm gonna go ahead and find your popliteal pulses. So these are gonna be on the back of your knee. Okay, right here. Now I'm gonna find the other one. Right, yeah. Awesome. Your popliteal pulses are symmetrical.
Okay.
So now I'm gonna move on to your posterior tibialis pulse. So this is gonna be back here. If you're good, nice and strong. All right, yep, they are symmetrical and strong. Now I'm gonna move to your dorsalis pedis pulse, which is on the top of your foot. All right, very good.
Okay.
Yes, your pulses are all symmetrical. Now I'm gonna go ahead and move to your feet over here. I'm gonna assess your capillary refill
Okay.
on your toes. Everything looks good. It's under 3 seconds.
Okay.
Right. Now I'm gonna do a little sharp and dull sensation
Okay.
on your legs. So I have my dull and my sharp.
Okay.
So for reference, that's sharp
Okay.
and that's dull.
Okay.
Okay, so I'm gonna have you close your eyes and I'm gonna poke you in different places and I would like you to tell me where I'm touching you,
Of course.
left or right side.
Okay. Sharp right thigh. Dull left thigh. Dull left shin. Sharp right shin. dull, top of left foot, dull, top of right foot, dull, bottom of left foot, and dull, bottom of right foot.
Awesome. You got 8 out of 8.
Cool.
Perfect. Alright. Alright, I'm gonna have you sit up slowly.
Of course. Face you?
We're gonna face this way.
This way. Okay.
Alright. I'll have you go ahead and put your socks back on. You weren't dizzy at all when sitting up?
No.
Alright, good. And I'm gonna go ahead and take a look at my rubric real quick here. Got a little bent up. All right, so I'm gonna do a little test on your patellar reflex.
Okay.
So just go ahead and relax.
Sure.
Very good. Very good. Are your knees ticklish?
Yeah, something like that.
All right, so I'm gonna go ahead and test your strength.
Okay.
So I'll come down here. I'm gonna put my hands on top of your feet. Can you push up?
Yes.
All right, and push down. All right, good. Push out and push in. Good. All right, good strength.
Okay.
Okay. Now I'm gonna go ahead and test your coordination
Okay.
before we move on.
Okay.
So I'm gonna have you touch my pen light, touch your nose, pen light, nose, pen light, nose. Beautiful. All right, I'm gonna have you make an okay sign, and I'm gonna have you touch all of your fingers. Go as fast as you can. Good. All right, hit your hands on your thighs, flip them, go as fast as you can. Good. All right, your coordination is good, so I'm comfortable with you walking. Now this is a high bed, so before we get down, I'm gonna have you put your shoes on.
Okay.
All right, very good. Hold it down.
Thank you.
All right, stand still here. I'll tie you down. All right, and I'll have you stand towards the wall here.
Okay.
All right, I'm just gonna have you stand with your feet shoulder width apart, hands down by your side. I'm gonna have you close your eyes, and I'm just watching your balance here. Very good.
Okay.
All right, so now I'm gonna have you, we're gonna walk this way.
Sure.
I'm comfortable with you walking. Your
Okay.
balance is good, very little swaying.
Good.
All right, so let's walk this way normally.
Sure.
Go ahead and pivot. All right, and then walk back heel to toe. Very good. Awesome. So we are done with your head to toe assessment.
Okay.
You did very good. After assessing you, I feel comfortable giving you a Braden score of 23. So you have no impairment in your sensory and perception. You have no excessive moisture issues. You are frequently active. You have no limitation in your mobility. You have excellent nutrition, and you have no friction and shear issues. Thank you so much.
Thank
Have
you.
a good day.
Thank you.